We live in a world where we've made more technological advancements than we thought were possible. Look at this meme as an example.
I bet there will be flying cars in the future.
Newer generations have created impressive strides in technology, are more vocal about mental health, and are committed to breaking the associated stigma.
According to scientists, mental health disorders occur due to poor communication among neurons in the brain. Examples of such conditions include depression, anxiety, and bipolar disorder.
Have you ever thought about how the older generations treated their mental health? Well, it began with lobotomies.
A lobotomy is a surgery that cuts a portion of the brain to isolate it instead of entirely removing it. The first lobotomy was performed by Dr. Gottlieb Burckhardt. His reasoning for the procedure was to calm down individuals with mental health conditions. However, the results of his surgeries were trial and error because 2 of his patients passed away due to complications of the surgeries. Years later, Dr. Igis Moniz developed the prefrontal lobotomy.
Have you ever seen the 2 holes in Frankenstein's head? Well, it's similar to how people's craniums looked after this procedure.
This surgery drilled 2 holes into a patient's skull and infused them with ethyl alcohol. Now, let's take a look at the brain. The brain's prefrontal cortex is at the forefront. When we learn something new, our prefrontal cortex plays a crucial role in storing that information through cognition, specifically when it comes to memory, episodic and short-term.
Episodic memory allows us to remember specific life events. For instance, our friend's 12th birthday party. On the other hand, short-term memory allows us to retain information for a brief moment of time. For example, when you meet someone new and you try to remember their name.
Some decades later, Dr. Walter Freeman created the famous transorbital lobotomy. This surgical operation involved inserting an ice pick-like device under the patient's eyelid and through the eye socket into the frontal lobe.
However, the procedure caused adverse side effects. These side effects included seizures, loss of urinary control, loss of language ability, loss of appetite, and chronic headaches for many people.
Lobotomies are done on several people, and they were transformed when the medical industry developed medications during the 1950s. Common pharmaceuticals used in today's society are antipsychotic drugs, such as chlorpromazine, which decrease the brain's volume and help with mood regulation and psychotic symptoms. Antidepressants, such as tricyclics, balance the absorption of monoamine neurotransmitters, reducing anxious and depressive symptoms.
Practical techniques have replaced lobotomies. These include therapy, residential treatment programs, and medication. It's a no-brainer that lobotomies are now rarely performed.
The world of medicine has evolved significantly in this regard.